Hi everyone. In today's video, we will discuss two questions. The first question is related to the blood group, and the second question is related to vaccines. Let's have a look at the first question. In an emergency situation, a patient receives an untyped blood transfusion from a volunteer donor. The recipient is known to be a universal blood recipient. Which blood type does the patient have? In here, a universal recipient means that the patient can accept blood from any donor without risking an immune reaction. The options given are A, type A, B, type AB, C, type B, D, type O. Before we proceed with discussing the correct and incorrect options, let's first review the ABO blood system concept, which is based on the presence or absence of A and B antigens on the red blood cells. Each blood type produces antibodies against the antigens it does not have. For blood group A, it has A antigens, so it will produce anti-B antibodies. For type B, it has B antigens, and so it will produce anti-A antibodies. For type AB, since it has both A and B antigens, it will produce no antibodies. And for type O, since it has no A or B antigens, it can produce both anti-A and anti-B antibodies. So the correct option here would be B, type AB. A type AB is known as the universal recipient. This means that they can accept blood from type A, B, AB, or O donors. And the reason behind is that the type AB blood contains both A and B antigens on the surface of the red cells, so they won't produce any antibodies against A, B, or O antigens. Option A is incorrect because type A recipient, they can accept blood from type A or type O donors. They will produce antibodies against type B or AB blood. Option C is incorrect because type B recipient can accept blood from type B or type O donors, and they will generate antibodies against type A and AB blood. Option D is incorrect because a type O recipient is actually the universal donor, but not a universal recipient. They can only receive blood from other type O donors because they produce antibodies against both A and B antigens. Let's have a look at the second question. A 10-year-old boy undergoing chemotherapy for lymphoma needs booster vaccinations. Considering his immunocompromised state, which of the following vaccines is safe to administer? Now here, when a child is undergoing treatment for lymphoma or leukemia, their immune system is weakened due to chemotherapy or the disease itself. This will increase the risk of complications from certain type of vaccines, especially if it's live vaccines, which contains weakened but living forms of viruses or bacteria. So in such case, we should only give the child inactivated or subunit vaccines as they are considered to be safe. The options which are given here are A, hepatitis B vaccine, B, measles vaccine, C, oral polio vaccine, D, rubella vaccine, E, vaccinia vaccine. The correct option here would be A, hepatitis B vaccine, because it is a subunit vaccine, meaning it contains only a part of the virus, which is the hepatitis B surface antigen protein produced via genetic engineering. It is not a live vaccine and cannot cause disease. Hence, it is safe for immunocompromised patients. Option B would be incorrect because the measles vaccine is a live vaccine, and in immunocompromised individuals, live vaccines can replicate uncontrollably and cause the disease which you're actually meant to prevent. And option C is incorrect because the oral polio vaccine is also a live vaccine. There is another alternative which would be considered in immunocompromised individuals, and that would be the inactivated polio vaccine. And option D and E are incorrect as well because they are live vaccines. Now, the key learning point here is that for immunocompromised patients, avoid live vaccines as their weakened immune systems may not control the attenuated pathogens and hence it can lead to the infection. Instead, we can use the inactivated vaccines, the subunit vaccines, which do not contain the live organisms.